You're listening to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati spine procedures, Alfred Bonati, MD. Once again, here are Dr. Bonati and your host, Kimberly Brumell.
Thank you for joining us on American Medicine Today. I'm Kimberly Brumell, joined by Ethan Euchre.
Happy to be here, as always.
Jeff Wagstaff.
I'm absolutely ecstatic to be here.
And world-renowned...
overjoyed.
As always. And world-renowned orthopedic surgeon, Dr. Alfred Bonati of the Bonati Spine Institute. Thanks for sharing your time with us.
Don't be here.
What do you got,
Don't
Doc?
be here.
He's giving me a hard time.
I love when he stares at you because you're being a clown over there, that you're ecstatic to be here.
We go on the break. I throw him a couple Chick-fil-A nuggets. He's my buddy.
Now he's happy. You guys are tight again. Yeah. I like it. All right.
Oh, we needed to take a quick lunch excursion. Anyway, we have an exciting show. We have Dr. Ying-Fu Lee and John Brennan. They're going to discuss a paper test. Apparently, they have some sort of like litmus type test to diagnose different
A whole bunch
diseases.
of different illnesses,
Yeah.
And apparently it only takes, a very small amount of blood or even sweat
Right.
and things like that. So, I guess they resemble those Listerine strips.
Right.
In the sense that
Yeah.
that's the type of, it's not
Material.
paper per se, but
But
it's more like a Listerine strip.
Oh.
No, you don't put it
Interesting.
in your mouth,
But hopefully it doesn't dissolve.
yeah, I don't know. We're going to have to ask him, but
Yes.
it's pretty interesting.
And then we have Professor Michael Carastro. He's going to be on to discuss some ongoing cancer research they have. And I think it has something to do with green tea extract.
Yeah, green tea, and he's a professor at the University of Tampa here in our home base of Tampa, Florida.
Right.
So I
Should
guess
be
they're
interesting.
doing some pretty interesting stuff.
And then, of course, we'll hear what's new in American medicine today. But, when it comes to problems with your spine, nobody likes to ever rush into spine surgery, and we don't advocate for that. But we have so many patients that come to us after having failed back surgeries by some other lesser spine institutes in the world. And they say, we wish we would have found you first. I was being told I needed to go through an invasive procedure. You needed to be filleted down the front and in the back. And, my own mother had invasive open back surgery back in the 80s. She has a crisscross scar. And then she made her way down to the Bonati Spine Institute because her back was bothering her. And now she's walking. She's doing things without pain. And it's amazing because I saw her suffer for over 3 decades as a little girl. She wasn't able to interact with us kids. And I see that interaction diminished with my own daughter and now finally having a chance at a normal life with no pain. Speaking of that, we're excited because up now...
In today's Back to Life segment, we will talk to a patient of the Bonati Spine Institute who went from living a life that was restricted by pain and discomfort through their journey of finding the Bonati Spine Institute and are now living pain-free.
Joining us from Lakeland, Florida, on the line is Tommy Couch. Thank you for sharing your story with us.
Hi there.
Hi.
How's it going, Tommy?
How you doing?
Good.
Doing well.
Well, why don't you tell us what type of work that you are in? What's your line of work, and how did you come to be in pain? Did you suffer an accident?
Well, I work out at the mines, out at Mosaic Mines, out in the Mulberry area.
Okay.
And my pain started way back, probably 30, 40 years ago, and I've been in pain, but it just keeps getting worse
Got it.
as time goes on. Mm-hmm. So I just started looking for somebody to do something on my neck, try to straighten it out, because I could barely turn it, get any good sleep or anything like that.
Okay.
And I had a hard time trying to find somebody that I could really trust and feel like I could trust to do it, because I didn't know anything about spine surgery or anything like that. So
Let me ask you, you talk about problems with your neck. Were you in an accident? Was it something on the job? Can you just kind of explain how you think problems may have arisen?
all through my life as a kid and growing up, I've worked all my life, hard work, labor, and there's been things that could have caused it anywhere. I mean, I fell through roofs. I've been in car accidents. I've been in things that probably could have made the neck injury worse.
Sure.
But I was told it was the spurs that were more or less making the pain kind of pinch the nerves or close the nerves off to make the pain.
So
and what did this pain feel like, Tommy?
Exactly.
Whereabouts on
the
your
pain
body?
was unreal. I mean, at times, sometimes you could kind of, by putting ice or something on it to kind of cool it down, but the pain was just unreal. You could not sleep. There was nights that I go through, just almost all night long, and I couldn't sleep. I'd be going to work and falling asleep trying to drive to work.
Ooh.
And that's ridiculous. I mean, nobody should have to go through that kind of pain. But
how long did you?
Bonatti, and hey, I tell you, I'm glad I found him. He's God's worth. I mean, he's worth every bit of what you got to go through to get rid of the pain, because that man knows what he's doing.
Well, Tommy, how'd you find the Bonatti Spine Institute?
Well, actually, before that, Jeff, when you talk about the pain, how was it affecting your life? How was it affecting either work or daily tasks?
Well, just regular work out there. I mean, when I'm like trying to move a motor or something, I'm using like a heavy hammer or something.
Sure.
I would be hammering on it to move it over just a little bit to line it up, and the hammer would slip out of my hand because I had hardly no grip.
Right.
The pain in my neck, I could hardly turn it to drive, to even look down the road sometimes, and it would make it hard to maneuver around like that. And just to look up in the sky, it was hurting, because it would hurt to look up or anything like that, and the pain would shoot down your arms. And there was times I even thought I was having a heart attack, and Bonatti told me, he said that was one of the nerves that was hurting in me, that the pain shot around to the front and made it feel like you're having a heart attack and going down your arm. And after the surgeries I went through, I feel fine.
Okay, you're fast forwarding through everything.
Yeah.
So
I'm sorry.
That's okay. That's okay, Tommy. You
I mean, everything that man has ever done for me since I've been down there, not just him, but the clinic, everybody there, they are the most kindest people. They'll go out of their way to help you in any way. And I tell you right now, if you got pain, you need to go to this man, because this man knows what he's doing. Well, he's not no clown out here that says, "Oh, I can fix you," and then later down the road you're still in pain. I'm telling you, the man knows what he's doing.
That's not some slick ad guy. That's a man's man.
That's right.
He is so laser focused. He kind of lets loose and enjoys this program. But when he's at the Bonatti Spine Institute, he is laser focused on trying to bring true patient resolve, where they don't have to be in pain any longer. Now, you talk about that pain that kind of wrapped around your chest. You had told me that you actually brought yourself to the hospital thinking you were having either a stroke or a heart attack. And what did they tell you when you got there?
They said it was probably like anxiety pain or something like that. And they didn't even really know it was coming from the spine part.
Right.
All they knew is that it was either like indigestion or something like that. They said they didn't really, because all the work they did to check me, I was in great health.
Right. So,
and they couldn't figure out why the pain was there.
So how did you make your way to the Bonatti Spine Institute?
Well, I, like anybody, hesitant to go any place and not knowing for sure where to go. I just saw on TV one time the Bonatti commercial, and then I done my research and looked through Google and things like that.
Sure.
And everything I saw, testimonies from different people and stuff like that. I don't know. I guess God was pointing me in the right direction and said, "This is the man you need to go see," because it was. And I don't have any doubt now in my mind. I mean, if I have any more problems with my spine, or if he works on any other parts of your body, I'm going to him. The man knows what he's doing.
Well, was it amazing to you when you were in that evaluation? You, from what I understand, you didn't tell him about that pain that wrapped around your chest. He just brought it up to you.
Right,
Did you think that was amazing?
When he said, "Now this part right here," we were looking. I mean, this is how good he was. Him and his doctors, the other surgeons, they all worked together, and like I said, they worked like a team, like a family.
Right.
And he was sitting there showing me the spine and telling me one spot there. He said, now, every time he pointed at a place that was closed off or something, he would say, "This generates down your arm. This generates and knocks out your, numbness in your arm or pain down your shoulder." Well, when he did that one, he sat there and said, "Now this one here, it generates down your neck, maybe in your shoulder, and then it works its way around like in your chest."
Sure.
And when he said that, I said, "Yeah." I said, "That's exactly what it does." And he sits there and says, "Well, and it makes you feel like you're having a heart attack. I said, yeah. I said, I've already been to the hospital 3 times trying to figure out what's wrong with me, and nobody can come up with anything.
Did you feel like for the first time you were being understood?
Yeah. I mean, the man knows his job. I mean, I don't know how he knows, but the man knows. I mean, he knows everything
training.
about.
Yeah.
Well, I understand he's not just specializes in the spinal part, because that's his main thing now. Mm-hmm. But if he can do the whole body, thank God for him.
Stub your toe, go see Benatti.
He does.
He can fix whatever.
He fixed my knee, so.
That's exactly right.
And the man is great, and everybody, not just him, but everybody down there. If everybody would treat people like they do at that institution, I tell you right now, you'd be a lot happier person.
Speaking about happy, why don't we fast forward? You're on the table. Did you watch, and what was that interaction like?
Oh, yeah, that was fantastic. I mean, truthfully, the doctor knows what he's doing. Mm-hmm. The one that was working on me was Dr. Lisp.
Okay.
And he was fine. I mean, to me, if somebody was looking over my shoulder, you might say, I was looking at a TV camera.
Right.
But if someone was looking over my shoulder, I'd be all nervous. This man act like there was nothing going on.
Right.
It's like an everyday thing, like going out riding a bicycle or something. And he was doing his job to perfection.
Right.
And when he got done, Benatti, now he didn't do it every time, but this one time he comes in and he looks to make sure that everything was done right.
Correct.
And I felt great.
And when did you feel a relief of the pain that brought you in? Of course, everyone has surgical site pain because you had surgery, but when did you feel a lift of the pain that brought you in?
When did I feel better about it?
Well, when did you start to notice a relief of the pain that brought you in?
Oh, the first 2 surgeries, I could feel the pain out of my neck. It's gone.
Right.
That day. But like I said, they told me the next surgery might, evolve or try to generate and be painful. So I said, okay, well, it did. And I got back there, and they took care of that pain.
Right.
So
the secondary
every time they did a surgery, on my neck, because they only do it in spots.
Correct.
And, the man knows what they're doing, because every time they did something, I walked out of there feeling great. And not just me, everybody I talked to in that clinic that was going to do the surgery.
Yes.
They were pleased with him, and some were scared. And I talked to them and told them, I said, you don't need to be scared of this guy. This guy knows what he's doing.
Well, thank you so much. You have such a great story, and I'm so happy that you finally found pain relief. And no, it wasn't just anxiety, and no, it wasn't just in your mind.
Mm-hmm. Well, I'll tell you right now, if anybody has any doubts about this man, call me. Give my number out to him and call me, because I'll tell you, the man knows what he's doing.
Look at that.
He really does.
Take it from Tommy.
Thank you so much,
Thank you, Tommy
Couch of Lakeland, Florida.
Thank you, too.
We're so happy
Have
to
a good
have
one.
you regaining your strength and getting back in motion.
Thanks,
Well,
Tommy.
I hope this stays this way, because it feels great.
All right.
Thank you.
Have a good one.
Thank you. Bye-bye.
You're listening to American Medicine Today.
Like that
Again,
guy.
Years of stories like this. This is true patient pain resolve. 98.75% patient-reported success and over 50,000 procedures performed. Make sure you stay tuned, because coming up, we're going to talk about that paper test where you can diagnose different illnesses. So make sure you stay tuned. It's really interesting stuff.
Revolutionary in his field, Dr. Benatti created, perfected, and patented the Benatti spine procedures. Using his genius, Benatti invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Benatti spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Benatti succeeds where others fail.
You're listening to American Medicine Today, presented by the Benatti Spine Institute, featuring the internationally acclaimed inventor of the Benatti spine procedures, Alfred Benatti, MD. Once again, here are Dr. Benatti and your host, Kimberly Brumell.
Thank you for joining us on American Medicine Today. I'm Kimberly Brumell, joined by Ethan Euchre,
Happy to be here.
Jeff Wagstaff,
Hey, Kimberly.
and world-renowned orthopedic surgeon Dr. Alfred Benatti of the Benatti Spine Institute.
Hello.
Now, joining us right now are biochemistry professors Ying Fu Lee and John Brennan at McMaster University in Canada. They've developed a simple paper test that can quickly diagnose illnesses by changing color, and they're on the show to discuss it. Thank you both for being here.
Great, thanks.
Great, thanks.
Yeah, now obviously this first thing it reminded me of are the old litmus tests
Yes.
from, chemistry and things like that from back in school where it changes color. Is that essentially what the idea is, gentlemen, except this tells you not the acidity or the base of a substance, it can actually diagnose an illness?
I think the idea is very similar, but we are testing different things. It's way more complicated, but
I'm
the
sure.
concept is very similar to the litmus paper idea. So we have a paper strip that can pick up molecules as an indicator of diseases.
Okay. And how quickly do the results come?
It can be anywhere from maybe as little as 5 minutes if we have a high concentration of target, up to about an hour for very low concentrations.
So let me clarify a little bit this. So what you are doing is you discover that different diseases, different illnesses had probably one type of a component, like some carbohydrate or some protein or some amino acid or something like that, and because of that, you target to check that product with the strip of the paper.
Yes, you got pretty much right. And so we can pick up, so it depends on specific disease and depends on the specific biomarker we want to detect. We can pick up DNA, we can pick up RNA, we can pick up protein, we can pick up small molecules. And so whatever that is the best indication for the disease, and we can design a paper strip for that detection.
Okay.
And so currently we focus quite a bit on genetic detection, DNA and RNA, is simply because it's relatively easy to find specific sequences for a specific disease.
Yeah, practically, just to educate a little bit the public with the idea is, for example, if you have diabetes and that strip is glucose, and then you just detect the glucose. And if somebody has, for example, a kidney disease, you have an excess of albumin in the urine, then the strip will detect that one. That's the idea, correct?
Yes, but it's a little more sophisticated.
Oh, I understand that, yes.
So everything would be done then, at not like a pH, but at the molecular level?
Right. The real, I would say the major advance of our new test is that it does DNA amplification directly on the piece of paper, which there's no other tests in the world that does that.
Okay.
So if you're familiar with the method of polymerase chain reaction as a way of amplifying DNA so you can get very, very low detection limits.
Yeah.
We're doing a similar, it's not PCR, it's something called rolling circle amplification, which has the advantage that it operates at a single temperature. So it's called isothermal amplification. But it allows us to take very, very small amounts of DNA or RNA and amplify it into large amounts of material that then generates a color change.
And what?
So currently in a medical facility, for example, they have the DNA, they put it in a test tube, and they place it in a machine. That machine can perform cycles of different temperature. And the reason they want to do that is to actually amplify the DNA molecule in that sample. And that DNA molecule is an indication of the disease. So you have to using this sophisticated equipment to do such an experiment. What we have done is we put everything on paper and we drop the DNA onto the printed paper sensor, and we wait for 5 minutes, 10 minutes, and 30 minutes, and so on. Then we're waiting for DNA to get amplified, and then we also develop a colorimetric, the color changing strategy, just like a litmus test, and to tell whether that DNA has been amplified.
And what type of illnesses do you start to study? I mean, which ones are in that type of a strip?
So we have a very large program in the area of infectious disease, and we work with a number of clinicians who work in the areas of respirology, gastroenterology, wound healing, where there might be wound infection. So that's one area. Another area we have a lot of action in is in cancer. So there's a lot of work in colorectal cancer. We've done some work in breast cancer, and we've started looking at prostate.
And how about neurological diseases?
So we are in the process of getting started on, say, Lou Gehr's disease. And currently there is no actually clinical diagnostic methods. So we are just in the process of putting together a research program towards that. And so, of course, Parkinson's disease. And so we are developing a technology platform that can be applied for any disease of choice. We only need to identify the necessary biomarker, whether it's DNA or RNA or protein or small molecule. And after we identify the biomarker, then the next phase is for us to apply this method to achieve the detection.
And this diagnosis is an early diagnosis that when you do this, when you can prevent that this disease will progress and do an early diagnosis, or it is a late diagnosis?
No, it's designed to be very early diagnosis. I guess the key features of our test is that we can get something on the order of 10,000 times better detection limit, which means that we can detect 10,000 times less material than what's out on the market today. And if you think of it from the point of view of very early stage diagnosis, the earlier you can detect that there's a marker that tells you there's a potential disease, the earlier you can do a therapeutic intervention, which usually means that there'll be a better outcome.
In summary, though, what is the application usage for this? Are you looking to do this purely for doctors' offices and hospitals, or will there be some take-home kit we can buy, off the shelves?
Public. I think eventually we really want to get to the hands of ordinary citizens, and so they could do tests on themselves. Yeah. And for certain situations, we just discussed about some early diagnosis. But you could imagine that you could also monitor the disease conditions. And so, for example, like a C. difficile infection or C. diff infection. So how do you know after you have been treated with antibiotics and the C. difficile bacteria is actually gone from your system? So you could be using these type of things to do easy monitoring instead of just come to the hospital and get checked up. And of course, it can also be used for more advanced application in doctor's office, and also for clinical laboratories for doing these kind of a test. Because one of the motivation is really try to save the cost. There are many good tests out there, but it costs hundreds of dollars. Correct. So these type of technology only costs much more. It costs less than a few dollars. So it is a huge saving for applications like in a hospital as well.
Thank you so much. This is such important technology. Biochemistry professors Yingfu Li and John Brennan at McMaster University in Canada. Thank you for telling us about your paper test that can quickly diagnose illnesses.
Thank you, gentlemen.
Thank you.
Have a good one.
Thank you.
Interesting stuff.
Yeah, make sure you stay tuned because next we're going to feature another biochemistry professor at the University of Tampa, and he's going to tell us about some updated cancer research. Make sure you stay tuned. You're listening to American Medicine Today.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
You're listening to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati spine procedures, Alfred Bonati, MD. Once again, here are Dr. Bonati and your host, Kimberly Brumell.
Thanks for continuing to listen to American Medicine Today. I'm Kimberly Brumell, joined by Ethan Euchre.
Always happy to be here.
And world-renowned orthopedic surgeon, Dr. Alfred Bonati of the Bonati Spine Institute. Well, we're excited because joining us in studio is Michael Carastro, biochemistry professor at the University of Tampa, and he and his team are doing some really interesting cancer research. And he's on to tell us all about it. So thank you for joining us.
Absolutely.
You got to turn your mic on, too. I forgot to tell you that part.
Oh,
Yep, that one.
this little
Yep.
There we go.
Uh-huh.
Now we can hear you. Nice.
even a stupid biochemist can figure that button.
So the cancer research, as far as what I was reading, does it have to do with some derivative of green tea, like a poly-E?
It does. So what polyphenol E is a very standardized mixture of the polyphenols that are in green tea.
Okay.
And so green tea contains polyphenolic compounds as well as caffeine. Not as much as you'd find in coffee, but a fair amount. And so when folks drink green tea, one of the things about it is that you can have different strengths of green tea.
Sure.
You can get different mixtures of the polyphenols depending on when the green tea is picked exactly. And so there's a lot of variability. Some of it looks darker, some of it looks more green. That's because
Sure.
there's different stuff in it.
Okay.
And so the advantage of something like polyphenol E is that it is a standardized mixture of the polyphenols in it, like EGCG and EGC.
So when we know that this green tea has a way of affecting cancer or helping, is it good? I mean, does a regular green tea drink help somebody fend off cancer? Or is that far-fetched?
No, it's not far-fetched at all. In fact, there's a lot of evidence out there that shows that regular green tea consumption actually causes reductions in inflammation and risk for all sorts of diseases.
How much of that, not to interrupt, but how much of that actually has to do with the caffeine? Because it's so weird we're having this conversation now. My brother-in-law is in town, and he was telling me, I love coffee, so does he. He said, I just read this crazy study that said the people that drink coffee, because there's a lot of caffeine and things like that, have half the levels of colon cancer and things like that. And so what's the link between caffeine and the cancer?
So it's not crazy at all. In fact, a completely different line of research that I've been working on for much longer deals directly with caffeine and its reduction of cancer risk. And I came to that not so much looking at cancer per se, but looking at a cellular mechanism called nonsense-mediated mRNA decay.
Okay.
And not right. So it was Zoom, right?
Yeah.
What is that?
Right over my head.
And essentially, what we were looking at is it's a mechanism that affects different RNAs in a cell differently. And one of the chemical compounds we were using to inhibit this process was caffeine. About the time I was looking at this, and this is back when I was at Penn State College of Medicine, we were seeing articles that were showing, for instance, individuals in Japan where they did a study of 100,000 people, and this was several years back. If they drank 4 cups of coffee or more a day, they had half the risk for hepatocellular carcinoma. Wow. And they did a lot of mouse, and there's been lots of studies out there like this with some variability. Part of the reason is not all coffee drinks are going to contain the same stuff in them exactly. They have different amounts, right, of caffeine and the other compounds in it. And so when they used pure caffeine on mice, and we've been using it on cancer cells for years, and we know that it kills a lot of cancer cells just like this. And there's been clinical studies where they combined it with chemotherapeutic agents, and it kills more quickly. On the mice, what they did was they put it on the skin, exposed them to ultraviolet C. If they put the caffeine on before or after the ultraviolet C, they saw large reductions in the skin cancer. And I know Revlon now has a patent to put it in anti-wrinkle creams and stuff.
Right.
So caffeine works by a different type of mechanism than the polyphenol E does, but they both have potential chemopreventative properties.
So
What is that genomic instability?
What is genomic instability?
Yeah, how that thing work there?
You mean with regards to the caffeine, or just
Yes.
in general with cancer?
No, in with the caffeine.
Well, so what caffeine does, the primary mechanism that it affects things like genomic instability, or the, as it turns out, the way that that it inhibits the formation of cancer largely, though it has pleiotropic effects. It has more than one effect. It acts as a kinase inhibitor. And as you may well know, there's a lot of signal transduction pathways that are involved in activating different mechanisms within cells. And so it's a kinase inhibitor and inhibits certain kinases. P53, the primary tumor suppressor gene, the big granddaddy of all the tumor suppressor genes, the main gene that prevents cells from allowing to become cancer, allows them to either stop growing and repair or go into apoptosis, programmed cell death. That protein has to be phosphorylated by two kinases, ATM and ATR, and they're both inhibited by caffeine.
Okay.
Right.
So when you're doing this research on cancer and the poly-E, how are you introducing that?
To the cells?
Yes.
We simply put it in the culture media.
Okay.
Yeah, and so we most of what I do, at least in my lab, is we use tumor-derived cell line models, clonal models.
Okay.
I have about 2 or 3 dozen of them in my lab, and several of them are prostate cancer cells that we use as models.
Where do you get these cells?
From ATCC.
Okay.
It's a national repository for cancer cell lines. Yeah.
Got it.
Interesting. And so I know you guys are doing here locally, of course, at University of Tampa, you're doing something with Moffitt Cancer Center, right? Which is one of the best in the country, really.
Absolutely, yeah, they are. It's a comprehensive cancer center, one of a very small number of ones that are designated by NCI as being the top comprehensive cancer centers in the country. So the polyphenol E actually was a gift, we'll say, from a collaborator of mine that I've known for many years out there. I was at Moffitt before I went to Penn State, before I came back to UT. And so my colleague out there, John Park, had gotten a fairly large sample of polyphenol E from a company in Japan that had the patent on it. And so he provided this, and there have been other studies where they've given it to humans, they've given it to mice who are, there's a very good prostate cancer model in mice called tramp mice. So we basically culture our cells. You'll see what that looks like. We grow them in dishes, we grow them in flasks with red stuff that looks like blood, but it's really a buffered solution that contains glucose and other things. We just add it directly to the media.
And what are the future applications for this? I mean, would these be supplement type pills that one would take with this?
Shots.
And they've already been doing trials like that. So you don't have to inject it.
Okay.
It's something that you can take orally. It would be it could definitely be. It has lots of potential to help reduce the risk or reduce the impact of prostate cancer and perhaps others.
Okay, you were talking about how one of the makeup companies is going to be able to put caffeine into a topical cream.
They're already doing it.
So
Yeah, Revlon.
with this poly-E, would it be something that is going to be in creams we're going to see hit the market?
So that's an interesting question because one of the things that I didn't add in, I didn't want to. I kind of felt like I was saying too many technical words when I was giving that earlier explanation.
I kind of felt that way too.
Yeah. So in that same study with the mice, it was actually a series of 2 studies. They not only treated the mice with caffeine topically, they also treated them with green tea extract, which contains caffeine but at much lower levels.
Sure.
And also the polyphenols, or the polyphenols that you find in polyphenol E. And so what they found was drastic reductions in the formation of skin cancers. And so the interesting thing was when they put it on before they exposed to ultraviolet C, or if they applied it after the ultraviolet C exposure,
Didn't matter.
they saw reductions of, going back like 12 years with this paper now, it was about 90% or so for the caffeine and closer to maybe 2/3 for the green tea extract.
Unbelievable.
So obviously, theoretically, these could be things that end up in our sunscreens and things like that.
Potentially,
Yeah.
I know that you also work on the vitamin D.
We have in the past.
Yeah. Tell us a little bit about how, because that's already a product that is on the market and all this. But how the vitamin D receptors are blocking or helping the people that they develop or the possibility to develop some skin cancer.
So just to kind of explain a little bit of what we did do with the NCI grant that we were working on with the vitamin D was actually vitamin D receptor. Mm-hmm. And as I'm sure well aware, vitamin D receptor is much different from other cellular receptors in that they are on the surface of the cell. Whereas with steroid receptors, which would include the vitamin D receptor, estrogen receptor, and so forth, those molecules penetrate the cell membrane and get into the cell, bind to the receptor, and then the receptor vitamin D or steroid complex goes into the nucleus and acts as a transcription factor to turn genes on and off. And so what we were looking at was a mutant version of the receptor and how that impacted cancer risk.
Well, it's certainly really interesting stuff. We're actually going to, when you said, talking about your laboratory, and you said you'll see it, what he's referencing is that Kimberly and I and Ben and the crew, Doc has surgery, so he can't go, but we're gonna cruise up to UT.
We're going to have all the fun without you.
And we always do, you know. Yes. Poor Doc's saving lives and helping people walk. They put me between
walls.
It's a shame. We'd love to have you there.
And we're traveling around filming for TV. So, yeah. But yeah, we look forward to it. It's really interesting stuff, and we appreciate you stopping by.
Absolutely. I appreciate you having me.
Thank you.
Michael Carrastro, biochemistry professor at the University of Tampa.
All right.
With his cancer research. Thank you for joining us on the show.
Thank you.
You're listening to American Medicine Today. Make sure you stay tuned because coming up next, you'll hear more about what's new in American Medicine Today. Make sure you stay tuned.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
You're listening to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati spine procedures, Alfred Bonati, MD. Once again, here are Dr. Bonati and your host, Kimberly Brummel.
Thanks for joining us on American Medicine Today. I'm Kimberly Brummel, joined by Ethan Euchre.
Happy to be here.
Jeff Wagstaff.
Yes, I am.
And world-renowned orthopedic surgeon, Dr. Alfred Bonati of the Bonati Spine Institute.
Hi.
Let's look at what's new in medicine today, featuring Alfred Bonati, MD.
So I have a feeling you want to talk about socialized medicine?
Well, here we are again in another round of politics. Mm-hmm. The situation is another abuse committed to medicine and the doctors. The politicians, every time that they don't know what to do, they grab medicine like...
it's their lifeline.
Yeah, I didn't want to say what I had in my mind, but I am
going
to...
Family show. I can only imagine what was in your mind.
Well, the problem is this. You have Clinton and you have...
Sanders.
Talking about socialized medicine.
Sure.
These people are so hypocritical, so incredible irresponsible. Mm-hmm. So these people is really, I really think the Democrats are like a drug addict.
Okay.
They always want a fix.
Yeah.
And then they don't want to pay the results.
Right.
And they cry more and more and more because the results are not what they expected. Mm-hmm. It's the same like a drug addict. Mm-hmm. They want a little injection, and then the next thing that happens, they cry because they don't have more drugs.
The problem is they're buying their dope with my money.
Exactly, and that's the problem.
I don't like that.
Well, let me tell you what socialized medicine is going to bring to us.
Okay.
Socialized medicine is study already failing all over the world.
Yes.
If you look, for example, socialized medicine in Spain, that in 1987, I think, Spain decided to go and
1978.
Oh, thank you. In 1978, I think Spain decided that they're going to do free medicine for everybody.
Right. It was their right.
And today is one of the sickest countries in the world.
Really?
Yep.
The next thing is, I mean, not really in the world, but in Europe. Mm-hmm. Now, when you look at the system that happens in other countries, for example, in England, you start to see that the only way that they can control the expenses of socialized medicine is killing people. So what they do is they are practically anybody who needs to be treated and become with a chronic type of a disease, and that will cost money to the government.
Right.
The first thing that they do is that they deprive these people in the hospitals of water and food.
Right. He's talking about something called the the one in the hospital system?
Yeah.
That's Liverpool Care Pathway, where they actually had a quota on deaths.
Yeah, they need to complete certain quota on death. If they don't receive money from the government.
Well, and there's only so many beds, right? So they need to sort of, all right, you're dead, go away.
Patients,
now we can bring in another patient.
Well,
something like that.
The worst part of it is that some of these people are so desperate that they go and they get the water from the pots that they have flowers, and they drink that water. That's how horrendous is the situation reported in the United Kingdom, that they talk about one of the most sophisticated countries in the world.
That's embarrassing.
Yes.
Wow.
Okay, embarrassing.
They starve these people to
They
death.
starve to death, and these people are so desperate that they go and drink the water from the flowers.
Right. Wow. You know, they had some interesting statistics. Breast cancer mortality rate is 88% higher in the UK than in the US, and prostate cancer mortality rates
look at the number that she just said. 88% higher.
Right.
Yeah, death rates, mortality rates.
And mortality rate for colorectal cancer among British men and women is 40% higher there than in the U.S. So when you model Obamacare after the UK, we should all be very, very scared.
Well, the other thing is, for example, the only country that is intelligent is the Swiss. The Swiss decide, we're not going to take this garbage, and the whole population decide that they are not going to go socialistic, and it's the only country that is practically it's an imitation of the American system for 20 years ago. So they are strong in medicine, and strong in results. The investigation is coming from there. The advances is coming from there now, and it's going to be coming from the United States.
Right. Did you know that Hungary's government-run system is in ruins, and thousands of doctors are fleeing that country?
No, I did not.
Because of the chaos in the healthcare system.
Wow.
And it also says that in Britain, a ton of doctors are also leaving the system, and people are leaving and spending millions in other countries just to avoid their medical system.
Yeah, well, you look at the problem that happened in Canada. In Canada, the people that they need to wait for a heart surgery or for the knee surgery or for the hip surgery is around 20 times what they can wait in the United States. Now, with the insurance companies, that is becoming a problem now, and that we need to start to pay attention, and we're going to start to talk about the insurance companies. They are trying to imitate these ones. They're trying to make the patients wait, and this initial wait then suddenly is going to come in years wait, because right now it is weeks wait, but suddenly it's going to become, if we continue tolerating this garbage, then it's going to become more and more problems. That's why the people need to start to look, what insurance are you going to buy?
Right.
Once you go and buy an insurance, you need to go and say, I don't want any waiting, I don't want any deductibles, I don't want any out of pocket, and if you don't go that one, look at another insurance. The only insurance that I really think we need to start to look very closely, because it's managed very intelligent, is United Healthcare and Cigna. The rest of the insurance are pure corrupted garbage.
And that's a look at what's new in medicine today with Alfred Bonatti, MD.
You know, I might be mistaken, but I don't think the doc's feeling the burn.
No, not even remotely.
No. And not Hillary Clinton, who thinks Obama has done no wrong.
Free cars for everybody.
Yeah.
All right.
Yeah, freebies aren't free, folks. And if we model Obamacare after these other countries, we are surely doomed.
That's right.
That about wraps things up on this episode and show and program of American Medicine Today. Make sure you tweet at Dr. Bonatti using hashtag American Medicine Today or hashtag AMT.
I want to punch the guy who invented hashtag.
Like us on Facebook. Also, check us out nationally on Bloomberg Saturdays and in Las Vegas on their ABC affiliate and here in Tampa on the ABC affiliate. We'll see you next time.
Revolutionary in his field, Dr. Bonatti created, perfected, and patented the Bonatti spine procedures. Using his genius, Bonatti invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonatti spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonatti succeeds where others fail.